Good evening. My name is Alejandro Morales, and today I'll be talking about the research paper that I wrote and doing a short presentation about the topics that I discussed uh, within that paper. Um, I like to start by first going over my thesis statement and research questions. Um, and so my thesis statement is that while electronic health records increase efficiency and accessibility within the healthcare system, they also bring associated risk with data privacy and misuse, which in turn suggests that there's a need for stronger regulatory frameworks within the industry. And the two research questions that I came up with were first, what are the primary benefits and drawbacks of implementing such records in the healthcare system? And then the second one is, how can these electronic records be securely designed uh, in a way that promotes maintainability, usability, and privacy? And in order to do this, I did some research, and first I would like to go over some of the sources that I use for to support my research. So the first one, it's called Implementing User Privileges in EHR Systems. And this article focuses mainly on data privacy by outlining the importance of using user privileges in order to protect patient confidentiality in these systems. Um, I also went over another article called Challenges of Interface Design in EHRs, and this article actually explores how there's a need for the medical professionals to be bring into the design phase, given that many of the systems that interact with EHRs are being designed without having the actual feedback of the end users, which are the healthcare professionals. Another source that I went over, it's called Integrating EHRs in the Indian healthcare. And this source is more particularly focused on the global impact of this issue, given that it explores how EHRs are being integrated in different countries and how they're shaping foreign healthcare records and healthcare systems. And two other sources that I use to support and back up my position are the global benefits of EHRs and EHRs in crisis management, which we'll explore later on. Now moving on to the next section, I would like to explore the pros and the cons of electronic health records. So on the positive side, we have that these records simplify coordination among healthcare providers, which means that even if we are seeing a different doctor, maybe in another country, maybe in another state, there's still a way for these healthcare professionals to have access to the same information in real time, which wasn't possible before with paper records. And this allows for a certain decrease in the possibility of a doctor giving the wrong treatment because they didn't have access to the right information or smaller things such as clerical errors. And then we also have found out that these records lower costs by preventing redundant tests and, like I said, conflicting treatments, ensuring that all healthcare providers have access to the same information in real time. In the negative side, we have that since EHRs are so portable, they're so, um, I guess, easily accessible or easily used in the internet and in online in general. They are much more likely to be prone to data breaches, which is something that we didn't see with the common paper records. So therefore, they usually are these data breaches are usually related to poor design or a certain misuse of administrative privileges, things like leaving a computer, I mean, in a hospital locked in with your information, and maybe someone else coming in and using your username and your password to have access to patient information that they could exploit later on. And another negative I guess another con that we have for electronic health records is that there's an excessive access. This excessive access, based on administrative privilege, also heightens the risk for inappropriate data exposure, which jeopardizes patient confidentiality, but it also reduces patient trust in healthcare entities and the healthcare system in general. So right now, I would like to move on to the impact uh, of the global, the global analysis of this issue. And I would like to say, I think that EHRs have been really transformative in a global scale. Many developed countries are currently using EHRs in situations such as crisis management. Notably, we can even think about how the COVID-19 pandemic affected the United States and many other countries, and how the government used EHRs in order to monitor vaccination rates and manage resources within different states or different regions. And in developing countries, EHRs are also being used to track public health trends and determining how to respond to these trends in a proactive manner. And like I said earlier, we have another example where we have like certain countries like India are actually they're prioritizing staff training in how to use EHRs over the design process. So they don't think that there's something wrong with how EHRs are being designed per se, but they are more concerned with how they are being used in making sure that healthcare professionals and clerical professionals um, are well informed and know how to use these records. And well, just to conclude, I would like to say that EHRs are uh, they represent an incredible advance in the healthcare industry, and they have improved efficiency, accessibility, and even global collaboration. However, I do think that they bring significant privacy risk and that they do require regulations. And I do think that in order to address these concerns, EHR systems uh, they should integrate some security protocols and be developed in close collaboration with healthcare providers, making sure that they are designed for the end users. I think role-based access, standardized workflows, and a higher focus on usability can significantly reduce misuse of these platforms. Also diminish the possibility of data breaches and enhance security as a result. Thank you.